Okay, thank you. I'm Michelle Graves, your host on today's segment of The Power of Money. I'm glad to have you here. Now, at The Power of Money, we are interested in three things happening. First, we want you to get the necessary education so that you and your family can make the decisions that will impact positively on you in your financial life. The second thing is that you be empowered to prosper. I only want the best for you. And you can only get that if you have education and then the drive to make it happen. And the third thing that is so important to me is that you recognize that life is more than a journey and that you be energized so that you can begin to participate in the truly joyous experience of living. So, here's to empowerment, here's to education, and here's to energy. I'm Michelle Graves, your host, Power of Money, and here we go. And here we go. I'm Michelle Graves, your host, and as always, welcome to today's segment of The Power of Money. And this is an exceptional segment. This one and the one to follow are going to be dealing with specifically Medicare. It's that time of year, again, fast approaching for those of you that are 65 or soon to be 65. This is a show you want to watch and listen carefully because it's very important. The fall open enrollment for Medicare, which is health plan coverage for people 65 and over, people that have been on Social Security disability for 2 years or more. This is your time. It begins October the 15th and runs through December the 6th. Any changes you make during the fall open enrollment will take place on January the 1st of 2020, right around the corner. In most cases, fall open enrollment is the only time you can pick a new Medicare Advantage or Part D plan. And you're like, I don't understand any of this. That's why I'm doing this show, because I know that you don't understand, and therefore I'm going to make sure you can listen to this next segment. Listen attentively. It's a segment I did 4 years ago with an amazing man, Jeff Hendricks, who is also certified to do Medicare. For the record, I am as well, but he is outstanding. So these next two shows are going to focus on that. The other thing I want you to be aware of, those of you in my viewing market, is that starting September the 25th, I will be partnering with the city of Trotwood, Ohio. Amazing Mayor McDonald, to do a financial boot camp for seniors. And our first segment will be Medicare Basics, September the 25th of this year, 2019, from 8:30 to 10:30. You have to register. There are no walk-ins. Seating is limited. You can call me on my 800 number, or you can register online by going to www.powerofmoney.tv. Those are the rules that gets you in the gate. I'm not going to say any more. We're going to go right into this teaching segment about Medicare Part 1, and you want to listen to it carefully and closely. The following week, we're going to roll into Medicare Part 2, where we talk about the Medicare Advantage and some of the nuances of the Medicare program. This is essential, particularly when you consider that 75,000 new entrants will be getting into this program. Not, the baby boomers. We're here. I shouldn't say. And welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, affectionately known throughout the United States and internationally as the Money Lady for the last 30 years. I know it's hard to believe, but I'm officially a senior now. And on that note, we're going to be talking today about a very timely subject for anyone who is approaching those senior years, and that is the subject of Medicare. I did not say Medicaid. I said Medicare. And as my guest today, I have an individual who has specialized in this very, very distinct area of insurance for a number of years. And again, as is my commitment to bring you, my viewers, only the very best in the business. Jeff Hendricks has his own agency, and he specializes in Medicare as one of the things that he does. But I had him on because, frankly, I'm confused. I know you say, the money lady can't be confused. Yes, I am. And I'm going to tell you why. Because you can't know everything. One of the things I share with people over the years, we are specialists in what we do. I do insurance, I do annuities, I do retirement planning, I trust work, legacy plan. That's what I do. When you start talking about Medicare, other than the fact that in 2 years I better sign up for it or else I'm going to get penalties, I couldn't tell you anything. But fortunately, I can refer you to people that do that. And on my go-to list is Jeff Hendricks. So he is my guest for the next hour. If you are approaching the age of 60 or are older, you need to know about this program. You need to know why you must be a part of this program. It's not an option. So on that note, we're going to be talking to him for the next hour, and I know you're going to learn just as much as I'm going to learn. How are you?
Fine, Michelle. Thanks for having me on your show.
Oh, I'm just delighted that you would agree to come, because this is one of those embarrassing questions, frankly, Jeff, that many of us do not know and do not understand, but we know that we're required to enroll. That much we do know. So where do we want to start?
Well, let's start by saying Medicare has a lot of moving parts.
Okay.
And that is why many people have difficulty when, after having worked, for example, for an employer for a number of years, where the employer made the decisions about what insurance they carried. And back in the day, the employer, you had one plan. And then as things became more modernized, maybe the employer gave you a couple of different plans to choose from. And then when you just think it's time, I'm going to, hang it up and I'm going to retire and I'm just going to taste the good life, now you got to learn about Medicare, Parts A, B, C, D, supplements, everything you can think about. And there's all kinds of companies and all kinds of choices, and you're on a timeline.
It's overwhelming.
Sounds like a lot of fun, what I do, huh?
I defer to your expertise, Jeff, because it's just too many moving parts.
It does get confusing.
Yes. So where does a person begin?
Well, to keep it simple, I would say the first step that you need to take is applying for your Medicare benefits.
Okay, tell me about that process. What are the age requirements? How do you apply? Give me some information here.
Well, let's start by saying that unless someone comes into Medicare on the back of a disability, which is a very difficult process, and you probably have heard about the difficulty people have in qualifying for Social Security disability.
Yes.
Well, if you qualify for Social Security disability, after a 2-year waiting period, you are then eligible for Medicare Parts A and B.
Okay.
For people that do not come into Medicare through a disability, the age that you are eligible is age 65.
Okay.
You are typically eligible for Medicare the first day of your birth month when you turn 65. So if you're born on the 9th, you're eligible for Medicare on the 1st.
So when do you need to enroll, on the 1st?
Well, that's a good question, because Medicare gives you a window, which is the month of your birth, 3 months prior to the month of your birth, and then 3 months after the month of your birth. Believe me when I say you want to be in the front part of that. You want to be on this as soon as you're eligible to apply, so that when you are eligible for those benefits, you've already made your decisions and things are in place. So that you don't need to rush. If you take your time and you plan ahead.
So let me be clear. In my case, because I'm born at the end of December, I would make application actually 3 months from the 1st of December.
That'd be November,
October, September.
You would be able to begin the process.
And where do you make application?
There are 2 methods of applying. One is for people that have worked past age 65.
Okay.
Their only option is the Social Security office. For people that are applying prior to age 65, one can go to socialsecurity.gov or medicare.gov and do a simple online application. Now,
really?
Yes.
Okay.
And for people that are turning 65 and you're applying online, the only question that you want to make sure, outside of putting in your name and your address and your date of birth, is they will ask you, do I wish to begin my Social Security benefits? Now, Michelle, as the money lady, I'm sure you've had opportunities to advise people about whether they
Those
should
spigots.
start drawing at age 65,
Or
whether they
66,
should wait, and those parameters are things that someone should discuss with their financial advisor if they have someone like yourself, or if they are lucky enough to have you, Michelle.
You're so gracious.
You can advise them about that part of the equation.
Right.
So for someone who says, okay, I'm going to sign up for Medicare, have it start the first day of the month of my birth, but I'm not ready to apply for my I don't want my Social Security benefits to start
Right.
yet. You simply have to indicate no on the box in the application if you're doing it online. Now, outside of that simple decision, the online enrollment process is simple for people that have any computer skills, and it does save a trip to the Social Security office, which sometimes can be a very pleasant and quick experience, and sometimes the luck of the draw means you're going to be there a while.
Yes.
For those people who have worked beyond age 65
and are still working.
Okay. There are situations where one can what you call defer enrolling in the part of Medicare which has a monthly premium, which is Part B, which we will talk about.
Okay.
And that Part B premium will not begin if you are covered by your employer's health insurance plan and your company has more than 20 full-time employees.
Okay, so let me get the math here. If you're still gainfully employed, which many seniors are today.
Absolutely.
They're still working.
Yes.
They need the money. Under that situation, you do not have to pay the Part B component premium.
You are considered to be in good standing with Medicare if you are working past age 65 and your employer provides health insurance coverage.
For 20 people.
20 or more.
Okay.
Now, smaller companies, the arrangement is somewhat different, and that's when one needs to apply for that Medicare at age 65, just like you were going to retire.
Now, what happens, and I don't want to jump ahead of you because this is so critical, this information. What happens, like my uncle who was working past 65 and he didn't apply for Medicare?
There is a penalty for people who enroll beyond their eligible date.
Okay.
That eligible date is a moving target for someone who is working past age 65 and working for a larger employer. You get grace for that period of time from age 65 until the time that you retire. And the way that is handled is, for someone that's watching this program and they're age 66 and they're working and they're thinking, you know, my day is coming soon. I'm getting out of here soon. Well, your employer will give you a form which you will then take to the Social Security office to say, here I am, I'm not 65 anymore, but I want to apply for my Medicare Part B, and I've got this piece of paper that says I've been covered under my employer's plan. It's all good. At that time, the Social Security or the Social Security office will go through that application process for you. That form from your employer will qualify to escape any late enrollment penalty that someone who just decided they weren't going to sign up because they didn't want to or didn't need it. And when that person who's been working then gets their Medicare Part B benefits, that Part B effective date is an important date for guaranteeing the right to buy coverage on the market without asking any medical questions. So it's an important thing to have your Part B in place at the proper time.
Whether you're using it or not.
That's correct. But for most people today that work past 65, most people work for a larger employer. Okay. And can rest assured that they don't need to spend that Part B premium, which we are going to talk about, and let's just say $104.99 while that's on the table here.
I got you. Per month.
Per month for Part B. Okay. For people who are either single and have an adjusted gross income of $85,000 or less, or married filing jointly and have a gross income, adjusted gross income of $170,000 or less. Woo. Above those levels, there are increased participation, we'll call it.
Okay, and that's for Part B.
For Part B premiums.
And Part B covers what?
Well, since the alphabet starts with Part A, I'm going to backtrack a little bit, Michelle, and talk about Medicare Parts A and B. Okay. First off, the Great Society, President Lyndon Johnson, signed Medicare into law in 1965, and a former president by the name of Harry Truman received the first Medicare card. Really? And at that time, there was no deductible for the hospitalization part, which we are going to refer to affectionately as Part A. And there was a $40 deductible for the part that covers other than hospitalization, which we're going to call Part B. Okay. Now, over time, deductibles have increased due to various reasons, increased costs, inflation factors, etc. But to understand how Medicare works, first we'll talk about Part A as being the kind of the institution benefit. Okay. And by that I mean Part A is what covers if you go into the hospital or if after a 3-day hospital stay, your care requires that you go to a skilled nursing facility. That skilled nursing facility is also covered under Medicare Part A. And there's no contribution by the applicant, I mean the person that's using this particular benefit for Part A. Part A comes with no premium if you have worked 40 calendar quarters. Okay. And for many people, that's not an issue. Okay. But take someone who has perhaps been a school teacher, been part of the PERS or the STIRS, the Teachers Retirement System, and then they leave the teaching field, and then they start working on getting those 40 calendar quarters. I've met with people that have worked for several years past age 65 because they want to qualify for that free Part A. Because if you don't have 40 calendar quarters, the premium can be anywhere from $224 a month to $407 a month for Part A. So just as people want 40 quarters for their Social Security retirement benefit, that 40 quarters is also the key to premium-free Part A.
So in a situation where a woman has been a housewife, homemaker, stay-at-home worker, uncompensated, how does it work for her?
Well, glad you asked that. Just as there are situations where a spouse will draw Social Security benefits from their spouse,
Yes.
they can qualify for benefits from their spouse. And if they have been covered under their spouse's health insurance, in the case of the stay-at-home partner where the other partner is working, the Medicare benefits that the Part B eligibility, for example, they would also get that piece of paper from the working spouse's employer saying, yes, this partner was covered under the plan and will not have a penalty for that Part B premium.
Right.
So Part A, besides covering the hospitalization and the skilled nursing facility, it also covers mental health inpatient stay. It also covers hospice care and an area that is increasingly important, which is home health care.
Okay, talk to me about that.
If you had the option of being cared for in your home or going to a nursing home, which would it be?
Always home.
Exactly.
No place like home.
Exactly. And not only does home health care feel better for you, it costs less too, and that makes it feel better also. And it also helps the government because the costs of providing home health care under Medicare Part A as opposed to a skilled nursing facility, it saves the taxpayers, which is ultimately us.
Oh, well, it is, yeah. So under the staying at home, and this is important because a number of seniors do watch this show, a person can get how much home health care? I mean,
well, it has to be a treatment, a plan of treatment that is designed by your doctor, and that Medicare will, if Medicare approves the plan that your doctor writes, the home health care portion is there's no contribution on your part.
Oh my goodness.
Medicare Part A takes care of that.
That is, and is there a limit as far as how many years?
Well, the form that it follows is similar to the skilled nursing facility, which is up to 100 days.
Okay.
So it gives you time.
So it's short term. It's not long term or custodial type things.
Right. And then when we talk about that arena, that's for another show.
Yes.
That's long-term care,
that's definitely long-term care.
Yes.
Yeah, that is. So, but a person does have the option of having treatment at home. Does that include a therapeutic or?
Let me give you a scenario. Someone I had a gentleman who fell, hit the back of his head, had to go to the hospital, was in the hospital. After he was in the hospital a few days, they put him in a skilled nursing facility for a couple of weeks, and then they said, well, we still need to keep an eye on you, make sure that that you're dressing on your wound, make sure that everything is right with you, and make sure that we come in and checking your blood pressure and making sure you're taking your medications. So that's the kind of situation where one leaves the skilled nursing facility, goes home, and then a home health care, which is typically an RN, sometimes it's a licensed practical nurse, will come in and visit you periodically to make sure that your recovery is on track.
Right. That's good information because I truly was not clear how that home care component worked. And frankly, because I do work with so many seniors and many of them are confused about what is paid for and what isn't. Shifting, it pays for hospice care too, because that seems to be an emerging area.
Yes, there is a small amount that can be due for some of the medication that is prescribed, and sometimes that's also waived. Depends on the facility. Yes.
So if a person is determined to be terminally ill, because hospice may be in a building or it can be at home.
That's correct.
So Medicare would pay for that component as well?
That's correct.
Is there a limit, like if a person is supposed to expire in 6 months and they're still here at the end of a year?
Well, you really have to talk to the hospice
Okay,
folks about
okay,
that. I
'cause
know
I
how
don't-
the coverage is provided, but I don't know
The timelines,
specifically
et
if there's,
cetera.
I'm sure it can't be forever because
Oh,
once
no.
again, see long-term care insurance,
Right,
right?
exactly, exactly. But that is also important because I do know that a lot of people today are finding themselves having to deal with hospice
Yes.
through cancer and through degenerative and chronic illnesses, and they're terminal and they're expiring. And I truly was confused myself, which is who's paying for this? Does Medicaid pay for this? And viewers, for those of you that are watching, Medicaid is not Medicare.
Correct.
Okay? Please don't get them confused. Medicaid has to deal with long-term custodial care where you are income qualified. You have to be poor. You have to be broke to be able to qualify for that type of care. That's not the same as Medicare, which is health care for people 65 and over. Okay.
Now, in talking about Hospital Part A, and we've talked about the fact that those who have the 40 qualifying calendar quarters,
Yes.
there's no premium for Hospital Part A.
Right.
And I mentioned that in the original inception of Medicare, there was zero deductible. Well, forward to 2015, and we'll talk about the deductibles for Hospital Part A,
Okay.
which will lead to why many people tend to purchase additional coverage called, in some cases, a Medigap or Medicare supplement policy to fill in the holes that I'm going to discuss with
goodness.
you.
Okay.
So the
All right.
hole in
Okay.
Medicare Part A goes kind of like this. I signed up for Medicare A and B, and I decided I didn't need a supplement because I'm pretty healthy. And I also bought a prescription drug plan, which we will talk about soon. But for this scenario, I have Medicare A, Medicare B, a prescription drug plan, and I'm thinking I've done what I need to do. Then I get hit by a car stepping out to get my mail, and I end up in the hospital.
Okay.
Or I have some bad food and end up in the hospital.
Got it.
That hospital visit has a $1,260 deductible, which you are responsible, which covers whether you're in there one night or up to 60 nights. So 2 months in the hospital, you can actually Part A, your cost could be $1,260, to which one would say, hey, 2 months in the hospital, that doesn't sound bad.
Right.
But the odds, if you have been in that long, the odds are you may end up being in from 60 to 90 days and possibly longer than that. And here's where it gets expensive.
Okay.
The month after you have had 60 days of inpatient hospital confinement,
Okay.
that next month is $9,450.
Whoa! 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 For
And
one
for
month?
1 month of Medicare Part A coverage.
Whoa!
Now, after that, there's an additional 2 months that is available, which is only $37,800,
37,000.
meaning that 5 months
Yes.
in the hospital,
You're broke.
which is what you're
You're broke.
$48,510. Let's just say you're
yeah,
broke.
Yeah. Come and get the dog.
Or let's
broke.
say that you have been financially dinged, to
Dinged.
say the
Yeah,
least.
yeah, yeah.
So there are Medicare supplement plans that pick up the hospital Part A deductible, pick up some of the other associated costs that come along with Medicare. And to talk about those things, we should talk about Medicare Part B.
Okay.
Now, Medicare Part B is the part which you have an ongoing monthly premium,
Right.
which does depend upon your income, and for most people will round it to $105 a month. That part of Medicare has a $147 calendar year deductible.
Okay.
Now, to think back when originally Medicare was made law, and to think about the types of situations that occurred involving medical care back then, well, let's see. Doctors came to the house.
Right.
If you didn't see the doctor at the house, you went to the hospital. Was there much going on that wasn't handled in the hospital? I know you are too young to remember, but I remember the doctor coming when I was sick and coming and giving me some yellow-looking stuff that always tasted just wonderful and knocked me out and made my mom happy anyway. But point being that when original Medicare was drafted, they used as a model the Empire State, and this is one time I will use the company's name, the Empire State Blue Cross Blue Shield plan.
Okay.
That was what they used as a template. Back in those days,
for a
yes,
national
for the
agenda?
national
Okay.
plan, that's what
Okay.
they used, was from the state of New York,
Okay.
which has always been very advanced in their insurance. And back then, people had the option of buying Blue Cross coverage and Blue Shield coverage. And Blue Cross covered the hospital, and Blue Shield covered what happened out of the hospital.
I didn't know that.
And since there was
Okay.
so little that happened outside of the hospital, a lot of people would say, I don't need the Blue Shield, I'll just carry the Blue Cross.
Okay.
Because the doctor's only going to be a few dollars, and there's not much else that's going to happen. So, because of that, Medicare Part B, which originally had that $40 deductible, was set up on what's called I'm going to use a term that people have heard and it's confusing, co-insurance. Now, co-insurance means that there's two participants.
Okay.
In this case, Medicare is one.
Okay.
And the Medicare beneficiary, as we are known when we receive Medicare benefits, is the other party to this co-insurance.
Co-insurance. So it's Medicare and me.
You.
Okay, hypothetically.
Right.
Okay.
Now, Medicare picks up 80% of the costs under Medicare Part B after the $147 deductible, leaving you with 20%.
Okay.
That 20%, which back when the coverage was designed really didn't have that much impact, that 20% is uncapped.
Uncapped.
Yes, so let's talk about some of the things that Part B covers and how that can be a problem without some additional coverage.
Okay.
Medicare Part B, if you think about it as everything outside of the hospital, is sort of what Medicare Part B covers to keep it simple. Okay? The Part B coverage, in addition to your doctor visit, your surgeons, any type of outpatient testing, we'll get into the area of durable medical equipment, speech and therapy if you have a stroke and you've got therapy afterwards. Basically, anything outside of the hospital admission or the subsequent trip to the skilled nursing facility or the hospice care. Everything else falls under that Part B with no cap.
Got it.
Cancer drugs are covered under Medicare Part B.
Oh, but they're so expensive.
20% of the cancer drugs can be expensive. Not to mention other forms of medication which are still covered under, some drugs are still covered under Part B. Osteoporosis drugs, for example, are covered under Part B. So this 20%, which back when original Medicare was designed, this 20% that then didn't mean a lot, now is a serious financial exposure. So if you took a situation where someone started out having cancer, went through the process of bone marrow cancer where you're having the stem cells harvested and your repeated hospital visits, all these are outpatient, none of this is coming, Part A is not coming into play to any of this. Then after the preparation that is necessary for them to admit you into the hospital to actually put in the new cells that they have extracted from your bone marrow over time. Then you're in the hospital, you've got the hospital admission. Truly, Medicare A and B can be a very costly situation when that type of illness or situation occurs.
So let me be clear. So in a situation where you are hospitalized for, say, a stroke, very common today.
Yes, it is.
Very common. So you go to the hospital, they admit you, and so you're there for the hospital bed. You're in a hospital bed in a facility. All of the drugs and all of the ancillary care falls under B. Is that correct?
In the hospital, it comes under A.
Okay.
Which means that $1,260 that you're responsible for, even if in the instance of a stroke, you're in, they keep you for a couple of days, run all the tests, make sure everything's okay, and tell you you're on your way, and here's your list of prescriptions, which we would be talking about Part D, which we will talk about shortly.
Okay.
That Part A, $1,260, like I said, whether it's one night or whether it's up to 60 days, you're starting with that.
Okay, got you.
Then beyond that, you come out of the hospital, you've got therapy, maybe you need to learn to walk again, maybe you need to learn to, you have speech therapy. Those are all Part B costs.
Okay.
And once that $147 deductible has come out of your pocket, then the 20% starts.
20%.
Exactly.
That can get very, very expensive, Jeff.
Yes, especially when the technology today is doing great things medically, but it comes with a price. And that's
and it comes on the backs of, and I'm not trying to be demeaning, but seniors are on fixed incomes for the most part. They're no longer getting a check. They've retired. And so in addition to them having to pay that monthly premium, because your threshold was $85,000 for single and $170 for married, but they still have to pay those deductibles and that premium, and now you're talking about I mean, let's just be frank about it. Seniors have illness issues. Stuff happens.
And there are options that people have to protect themselves, and it comes at a price, but there are options in order to that allow one to fill the holes of Medicare A and B.
And we're going to talk about that.
And we're going to talk about
that. Okay,
that.
Thank you so much, because I'm starting to get a little bit nervous. I'm just saying, just thinking of my clients and people that are out here and knowing that 7 out of 10 people, Jeff, are leaving this planet because of chronic healthcare issues. That's a fact. They get sick over 65 at a disproportionate rate to the general population. Young people don't have all this stuff happening.
That's right.
You know, but boy, oh boy, that crossover point, now all of a sudden you're on a fixed income, you've got assets that you're trying to liquidate to live on, and now you're sick.
Yeah.
Now you're sick.
Which makes everything harder.
Which makes everything harder. So let's talk about that.
Which means that the proper planning, and again, when I talked about that 90-day period of time before the month of your birth where you're going to receive those Medicare benefits.
Right.
During that period of time, you can get your ducks in a row. You can do your own research. You can go online to Medicare.gov.
Okay.
You can go to Social Security and pick up the book called Medicare and You, which is about this thick,
Oh.
which many times make people's heads spin. Or you can meet with someone like myself who is certified to offer coverages with plans from companies that have plans to fill these gaps. So, when I talk about Medicare A and B, and people are somewhat familiar with the fact that I get a Medicare card, it's got A and B on it. In 2006, President Bush brought out Medicare Part D, which was the prescription drug plans. Now, D for drug, right?
Right.
Well, actually, there's a Medicare Part C that is becoming more popular, and we're going to double back to that. But we're going to talk about now Part D.
Okay.
Part D is the plan that came out 9 years ago, where the federal government provides help with your prescription drug costs, and these plans are offered through private insurance companies. When the policies came out in 2006,
Okay.
there was a lot of confusion over how the plans were designed, whether you needed to sign up for one or not. And for someone that's turning age 65 or someone that's worked, say, to age 67 and then are retiring and then starting their Medicare coverage, that Part D prescription drug coverage is an important choice. There's a range of plans available, from plans that are under $16 a month. I will not talk about any specific companies, Michelle, but just as a range of premiums. And the prescription drug plans have been doing better in certain respects, and some of the plans that were around that were over $100 a month just in premium, now that there are plans between $15 and say $60 a month that provide varying levels of coverage in order to allow for someone who doesn't take many medications to have a less comprehensive plan with an appropriate less premium, or someone who has conditions that require medications that come at a price. They can buy a better prescription drug plan. And when I say better, I mean more comprehensive in coverage, but it's also more expensive.
So this is not, looking at this, Part B has to deal with doctor visits, outpatient.
And certain intravenous drugs. Osteoporosis,
but the
drugs.
the drug piece, which is so expensive for so many of our retirees and seniors.
And those that come into Medicare through disability.
And that, oh my gosh, yes, I was thinking about that component part as well. What President Bush in 2006 did was put this Part D into place through private insurance companies.
And you see their names, and they're well-known household names, the majority of the plans. Now, there are some plans whose names you won't recognize that are also effective.
Oh, really?
Yes, but the issue of picking your prescription drug plan, it's another thing, another choice that one must make. When they first came out, a lot of people said, I don't need that. And then several years go by, then they need it, then they find out that there's a penalty because they didn't sign up when it was offered, and that penalty, I've seen people that have a $20 a month penalty, which lasts for the lifetime until they are no longer on a prescription drug plan. They are paying an additional amount per month on top of their premium, and it never goes away.
Because they did not plan.
Yes, exactly. And because when it first came out, again, there was a lot of confusion about how these plans operated. And that confusion was not simply in the public, it was also in the industry. So there were insurance agents that would say, you're taking a couple meds, why don't you just wait?
But not at a penalty.
Once again, and when things are new, sometimes misinformation is just an inherent issue that can rise up.
Got it.
So the Part D prescription drugs, got a little data on some of the most popular prescription drugs. Medicare just released its first ever information on what's being prescribed, what it costs. And if you look at the top 10 medications that are prescribed, and this is from the Centers for Medicare and Medicaid Services report, their 2015 fact sheets that came out, which is available at medicare.gov. Lisinopril, simvastatin, levothyroxine, hydrocodone acetaminophen, amlodipine mesylate, omeprazole, atorvastatin calcium, furosemide, metformin, metoprolol. These are all medications that are blood pressure, that are diabetes, that are the statins for cholesterol, and then some heart medications. These medications are all, in the The beneficiary count for lisinopril, over 7 million people receiving taking
Goodness
lisinopril.
gracious.
The total drug costs of the number one medication were $307 million, just for one generic medication. So the scope of the number of people that are participating in the prescription drug plans and the costs associated with those are really substantial.
I would have to say, personally, Jeff, that's a prescription for bankruptcy. There's no way, and I'm just saying this as Michelle speaking, what portion of that does the government have to pay?
Well, that's a
Okay.
very good question. I'm glad you asked. The prescription drug plans, as they are set up,
Right.
are quite effective for people that just take a couple of medications.
Okay.
Because the first stage of coverage, you pay a copay.
Okay.
Much like for people that are used to plans that they've had through their employer.
Okay.
The prescription drugs on the drug plans are set up in what they call tiers, which are basically relating to cost and efficiency.
Okay.
And the lower cost medications, of course, have a lower copay, and the more expensive medications have a higher copay. Some of the areas that are really expensive for people receiving Medicare Part D plans are inhalers,
Okay.
and of course COPD has become a huge problem.
Right.
And
I'm stunned on that. I still
And-
can't figure out what that's about.
And the total drug costs on the brand names, we talked about the total drug costs on the most popular generic being $307 million. Well, Nexium.
Yeah.
It's not an inhaler. It is a
Tummy.
It's for your GERD, the
Yeah,
gastric reflux. GERD. Yeah,
Uh-huh.
thank you. 2.5 billion, and the medication that, and I won't just talk about it. Everybody's seen the ad with the elephant sitting on people's
Yep,
chest. A good way of showing how difficult people can have breathing with COPD. That comes in just a little under $2 billion.
$billion.
Yes. So the cost of the generics versus the cost of the brand drugs, and the brand drugs are all the new things that are coming out.
Yes.
And this is the storm that is going on within the prescription drug industry, and it is something that they're attempting to deal with. And it's difficult because we have such a high level of usage in some of these very costly medications.
Right.
But back to the design of the Part D, for someone who has a couple of brand drugs, for example, one can go through the year simply paying the copay for the drug, which might be $45, $50, $40, $30, $55, $60, some drugs even high as $95. And that is an amount per month that they're paying. In addition to the premium for the drug plan, they're paying the copay for the medication. But for people that have multiple brand medications, and there are many that I meet with, and it's heartbreaking, Michelle, really is. There's a thing called the donut hole, or the coverage gap, and how many people have heard the term donut hole?
I have heard it.
And it's like this, my mom's in the donut hole, and I'm having to pay some of her medication costs. Very common thing. Very common thing.
Tell me what that means.
The donut hole is the point in the Medicare prescription drug plan where the portion, the initial coverage stage where you pay a portion and the insurance company pays a portion, that stops. And then you are paying, and for generics, for generics this year, it's 85 to 86% of the cost of the generic drug. For brand drugs, it's 47.5% of the cost of the brand drug.
You are responsible for.
Yes. So that medication that maybe cost you $45 a
Yes,
month when
yes.
you're in that initial coverage stage,
Yes.
all of a sudden is $150. You take someone that has 3 medications that are in that area, and all of a sudden they're talking about $300 to $500, sometimes I've heard $700 a month in prescription costs. People that have inhalers and have brand heart medications, and there are a number of medications now that are designed to replace the most commonly used blood thinner for years and years called warfarin or Coumadin. And by the way, it's the component of rat poisoning. So,
Right. So don't get crazy
There's
here.
a lot of people that prefer not to take the generic, least expensive drug because you have to go and have your blood monitored on a regular basis. If you eat too much salad, that'll throw off your blood level because the salad thins the blood beyond what the blood thinning mechanism of warfarin uses. And I won't get too technical. I'll just say that some of the new brand drugs that you see advertised, you can eat salad all you want. It works on a different part of the
See, I didn't
bloodstream.
even, you know what? That's so funny you say that, because I was like, what's the big deal about eating salad? I eat salad all the time, but it was said in a way that you need to not be eating all this salad.
And when you are taking, when you
I
have
mean,
problems
my
with your
goodness
heart,
gracious.
and then you're told that you can't eat something that's beneficial,
It's confusing.
it's a conundrum.
It's a conundrum. You
So-
can't figure it out. Right.
So these new drugs that don't require you going sometimes as much as twice a week to a facility to have them prick your finger and
right.
tell you what's called the INR reading is. The brand drugs don't make you do that, but the cost of them
Hoo-wee.
is where when someone is in the donut
hole. It's all on
it's
them.
an expensive process.
Yeesh.
Now, when you hear people say, if you've heard people say, well, you can expect to spend $10,000 to $12,000 a year on your health costs, for someone that has serious health problems, it's very possible, because the prescription drug coverage, once you have spent out of your own pocket $4,750,
Yes.
then you're on the other side and you're looking at $2.65,
Right,
$6.30
right.
after you've been, put through that.
Right.
So you've spent $4,750 plus you spent that monthly premium every month, and that's just for your medication. So the costs can be, and it varies so much, Michelle, because I'll meet with people and they've got a couple of generic medications and they have got a prescription drug plan where they're mail ordered. There's no cost for there's a zero premium for a 90-day supply of generics, and they're just
Doing fine.
Doing fine. And when they hear about people in the donut hole, it sounds like, gosh, what'd somebody do to get into that?
That's what my question is.
It can be one incident away. It can be one stroke. It can be one accident. It can be one fall. It can be one step away. And we haven't even talked about the drugs that are now being prescribed for Alzheimer's, and those are not in the lower cost, Michelle, as you would probably imagine.
Not at all. And they're actually, I was just reading in this week's Fortune magazine, the cover was on Alzheimer, and that's something that's near and dear to me. I put, I guess, over 20 years into working on this, trying to deal with this from a financial perspective, because it's devastating. It's more than just losing your family member. The costs. And this drug medication is so expensive.
And once again, we're not talking about long-term care, but the average number of a nursing home stay for a female with Alzheimer's is like 8.4 years. That's a long time.
A long time.
Yes. And just stripping away the emotions and just dealing with the finances.
Right.
The finances are just unwielding for most.
I think that's a fair statement, and yet it is epidemic. So under Part D, would the Alzheimer medication fall up under that category?
It falls under Part D, yes it does.
Okay,
So,
but you're going to wind up in a donut hole.
Unless it's a person who has no other conditions and is simply taking
Medication for that.
for Alzheimer's. And there are people like that. Everything else works except
That.
And that's where the medication that is prescribed is designed to try and slow down that degenerative process.
Oh, my goodness gracious. That is absolutely and totally unbelievable. Now, let me tell you what else is unbelievable. My producer said we got 5 more minutes.
Well,
so let's speed it up, and
let's talk.
Plan on having you back. That's what I'm going to have to do.
Let's talk about We've talked about A, B, and D.
Yes, let's talk about C.
We're going to talk briefly about C because C is an area of coverage that now about 30% of Medicare beneficiaries participate in. It's called a Medicare Advantage plan.
Okay.
And a Medicare Advantage plan is a plan that is contracted with an insurance company. The insurance companies once a year meet with the Centers for Medicare and Medicaid Services to determine what funding is available to the insurance companies.
Okay.
And the Part C Medicare Advantage plans work much more like the coverage that they're used to through their employer.
Okay.
Copay for the doctor,
Okay.
copay for the hospital. Many of the Medicare Advantage plans have prescription drug coverage included. The reason that Part C is called Medicare Advantage is the government tells the insurance companies, you're going to offer this, you're going to give people more than original Medicare, otherwise there's no reason for us to let you do this. So
Okay.
many of the Medicare Advantage plans have gym memberships, discounts on hearing and vision, and unfortunately, original Medicare doesn't really care much about your hearing or your teeth because you can live without both.
Actually,
So they're really
that's
not
true.
part of the Medicare arena.
Okay.
The Medicare Advantage plans step in and pick up some coverage there.
That sounds like a good option.
And it's something
It
that
really does.
It's something that is about 18 million seniors are in those plans now, and that is a
expanding,
subject.
growing?
Yes, they are growing, and Medicare is pleased to say that in 2009, only 17% of the Medicare Advantage plans were in a plan that are 4 or 5 stars by the star rating program the government uses. Now, in 2015, 60% of the people are enrolled in plans that are 4 or 5-star plans. So the government is giving the insurance companies parameters, and the companies are doing their best to hit those numbers. Because as the companies perform to the standards that the Centers for Medicare and Medicaid Services have set up, funding gets a little
Increases.
sweeter, which
Yeah,
then
gets-
allows the insurance company to give more back to their members. So
that
Part D
is
is something
nice,
that we can, or Part C is something we can talk about at a later point.
Well, this is what I'd like to say, because we have run out of time. I can't believe it, and I really am going to have you back. So I'm going to juggle some things, because this is too important. This, in my opinion, stands right up there with seniors, along with Medicaid and long-term care. And this is the deal. 7 out of 10 are going to leave this earth from these chronic conditions. And it's not young people for the most part. So would you kindly give my viewers a phone number and how they can reach you?
Yes,
questions and whatnot?
can reach me at 513
Okay.
379 4400. That's 4400. 513 379 4400. If you get my voicemail, you will get a return call as soon as
Yes, you do.
am able.
I understand. Turning back to the camera, my goodness gracious. Time has whizzed by, and I've got a long list of questions that I still have not had answers. So I'm going to have Mr. Hendricks on again shortly to talk about and finish this interview, because it was not complete. We got through A, B, C, and D, but there are a lot more questions that I have, and I know that you as my viewers have as well. You know how to reach him. I'm just going to tell you, it's just too complicated. I'm just going to call him and visit him before I'm 65 and make sure I've done all the things I need to do. Viewers, remember, you can't know everything. A wise man or woman recognizes that God has given us people that know what they know and are better than you and I will ever be. And that's why they're a blessing and a resource for you to avail yourself of. I'm going to conclude today's segment of The Power of Money with my very special guest on Medicare, Jeff Hendricks. And again, in closing, peace, love, and God bless you. See you next time. You take care. I'm Michelle Graves, and again, thank you for being a part of this very special broadcast on Medicare Basics. We're going to move into Medicare Basics Part 2 shortly, where again, I'm going to be encouraging you to be a part of the financial boot camp for seniors that is being hosted by the city of Trotwood, Ohio, and I will be your host for this amazing experience. But in closing, if you want to register, and you should want to, go to the website www.powerofmoney.tv or call my 800 number that is showing on the screen below. Thank you so much. God bless you, and wishing you the best during this enrollment period. I love my seniors. Take care. Bye-bye.